Hi, welcome back to my channel. I haven't done a video for a long time. So, this video is all about the CBT exam for the nurses. I have done lots of videos regarding numeracy and clinical skills. So, before I start my videos, please don't forget to subscribe my channel. And if you like the video, please press the like. And if you think like somebody to share someone, please share it, and you can mention your comments under this video, okay, only regarding these videos, okay, and some numeracy videos and clinical videos. But I thought like if I just simply saying the question and the answer, it won't be helpful for you for your CBT exam, or also because some of these questions you still need to remember for your OSCE. And at the same time, when you are going to work as a nurse in the UK, you need all these things, because this is not only for the sake of studying or passing the exam. This is for skill for your future. Not only what I mean by future means, if you are working here in the UK as a nurse, you require, you must these skills. If you need to use in the wards or ICU or emergency ward, wherever you work, you need these skills. So you can't just study only for the sake of passing the exam. You need this exam. You need to remember all these things. Okay, that's why I'm going to explain some of the topics that will be useful for your exam, and it will be useful in the ward. Okay, so just go and see what I have written in the board. I have written in here like skin. Skin is the largest organ in your body. Okay, that will be one question. So try to remember that skin is the largest organ in your body. So skin has got 3 layers that I have mentioned here, like epidermis, dermis, and subcutaneous tissue. Okay, so what is epidermis? That is the first layer of our skin. This is the epidermis. Okay, so that means that produce pigments, and that is protective covering as a immune system. Okay, so that is called epidermis. That's the first layer of the skin. So if you say 3 layers, even epidermis, we have got so many subdivisions. I'm not saying all that. So epidermis, dermis, and subcutaneous tissue. Okay, this is the first layer, second layer, and third layer. Okay, so second layer is called dermis. That is contain nerve endings, oil, sweat glands, and hair follicles. Our hair grows, the hair follicles that grows up to here, or our nerve endings, the nerves that will up to be here. That's a, and oil, the fat will be there. Okay, not fat, it's fat starting from here. So the third layer is called subcutaneous tissue. Subcutaneous tissue, we are the nurses giving the injection in subcutaneous. That means the needle should be reached up to here. Yeah, needle should be up to here. So subcutaneous. Okay, so that contain fat. So we are injecting medication in the fat, connective tissues, large blood vessels. So it's made up of fat, then it's contain connective tissues and larger blood vessels. Okay, so if you have any damage in that skin, and we are calculating the how deep the wound or which category is considering according to the damage happened on all these layers. Okay, so let me go and write all that. So The next part, if something happened to your skin, how do we say that? Okay, because this is the simple word we say. Like in English, we say formal and informal words or sentences, isn't it? Same like in the medical. If you say the normal people will come and say, oh, if you can see, I have got some bruise on my hands. Okay, bruise, that means you can see some people's hand like have got like a purple discoloration. Yeah, that is the first stage. Yeah, the purple red, then it goes to purple, then it's slowly starting to fade. Yeah, so that is called bruise. Yeah, but the formal word is contusion. Yeah, so second one, some if you have a fall and you have some like some like marks on the skins, then that's people come and say, the patient will say, oh, I have got some grays. That means in your documentation you may write abrasion, patient has got some abrasions. Okay, then some of the patient's skin is very thin. That type of patients are very prone to get skin tear. Okay, that or skin flaps, the skin tear. The tear you say has a laceration. Okay, just remember these words, and if you want you can just write it in the diary, and this will be helpful for your CBT exam at OSCE and in when you are dealing with the patients. Okay, because when you are dealing with the patient, this nurse's responsibility to check their skin. If they are not mobile or bedridden patients, or they are very risk of getting pressure sores, so you need to check their skins, and you may need these words to record in your documents or the pressure area chaos documents. Okay, so just remember these words. Then patients have cut, what do you say? Incision. They some patient had a fall and they have a cut on their head, so we will say incision. So some patients comes in the ED and they say, oh, somebody stabbed me from my back. So what you have to write? Not stab, puncture. Okay. So, and when you the patient have burns, there is no other words. So burns, I don't know any other words anyway. So burn is the burn, like you can get a burn like skin damage from some chemicals or fire or some medication, some creams. So there are lots of reasons, like the gas, if there are lots of reasons. So burn is burn. So I hope you understand these words. Okay, so bruise, graze, tear, cut, stab and burn. So I will just write the next wordings. So the next part I have written here about how do we care the wounds. How do we care the wounds? So firstly, we just think about I will explain here like this, so it's easy for you to understand as well. So how we care the wound? If you receive a patient in the emergency department, and he has got a small cut but slightly deep on his forehead. So the doctor assessed him. Doctor told you some advice what to do. That's the primary intention, primary care of treatment. So maybe they told you like, you can just suture that wound because it's a bit deep and you need to suture it. That is the primary intention. Okay, sometimes there is no need of doing the suturing. Suturing is really painful. So maybe they told you like, yeah, you can just glue it. There's a glue like in a small sachet. But before you apply that glue, you have to make sure that the wound is dry. So you have to dab all the blood from around or inside from the wound. then only the glue will stick properly. Okay, so you if you have a wound there, then you have to dab all the blood and it makes it dry and clean the wound with normal saline. Okay, then you have to open the glue and hold the, if you just imagine if the wound is like this, so you have to make sure it's to hold it like that, so it will be, there won't be any space between the the separated skin. Okay, so you apply the glue here. Okay, you apply the glue here, apart the skin, yeah, then hold it like this, then it will be stick. So that's a primary intention. Okay, I hope you understand. This is the way I know how to explain. Okay, if you know more detailed or simple way, please comment below in the video. Okay, so that's the first. That's what I have written here, that first or primary, that means suture or glue. That's a adhesives. Okay, and the second, how we do second or secondary. So some of the wound doesn't need to do anything. Okay, so we can just leave that wound to heal naturally. You can just leave the wound without doing anything, and for the naturally it will heal very well. Okay, how it heal, like the contraction and epithelialization. Okay, so third way, that's tertiary. So some of the wound you can't do anything, or you can glue it, or you can suture it, or you can't do anything. So why is that? Because sometime the wound may have infection, so if you close that wound with infection, it will be damaged more. So we have to wait until the infection is cured or the bleeding is reduced. Some of the wound has severe bleeding, so you can't do anything, so you have to wait for a while until everything is sorted, then you can heal it whichever way the doctor advised you to do it, or the doctor maybe do that process. Okay, so this is the 3 way of management. So I will just write the next bit. I'm just going to explain you the phases of wound healing. In CBT clinical skills, this is one of the questions usually asking. Okay, so just remember the stages, because sometimes they will ask you to rearrange the stages accordingly, or they just give some time like one phase is missing, and they may ask you to what is that third stage or fourth stage. Yeah, so they sometimes they give some situation and say what can you please mention what stage is that. So make sure you just remember all the stages very well. Okay, so what is the next stage? First stage is hemostasis. Hemostasis means if you have a wound, and what will happen just after that, some people the wound will clot very soon. How soon? In 5 to 10 minutes. Okay, the wound will clot, not the wound, the blood will clot. But some people the blood won't clot in that time, like the people who are taking the anticoagulants medications, warfarin or apixaban. There are many anticoagulant medications. Okay, so that if they have a wound, the bleeding won't stop. Okay, some people bleeding will stop maybe for a short, after some time, but you have to make sure that they are not taking any anticoagulants. Okay, so anyway, what I'm saying, so normally if a person has a wound and it's bleeding, means naturally it will clot in 5 to 10 minutes if they are not taking any anticoagulant medications. Okay, so that phase is called the hemostasis. That's the first stage. Okay, that's a clotting stage. So what will happen after that? if a patient has got a wound, and it will be inflamed. That's the next stage is called inflammatory phase. That means the vasodilation will happen. Vasodilation that will happen in 1 to 5 days. It will happen. Okay. So what is vasodilation? That means it's a dilated blood vessels. Vasodilation, dilated blood vessels. Why is it's dilating? Because there is a lack of nutrients and oxygen in that area of the wound, because it's a breakdown of the skin. That means there's our immunity, that's protective barrier, isn't it? So that's a breakdown happen. That means the blood vessel need to look after the skin to heal naturally. So what will happen is the blood vessels will dilate and provide more nutrients and oxygen to the area where that wound is. Okay. So I'm not prepared in a topic and just explaining. Okay, that's why sometimes when I'm trying to explain something, then I remember, if I I explain something else, because that topic may be relevant to this topic. That's why I'm just going everything in one go. That's it's just like that. Just excuse me for that. Okay, anyway, so that is inflammatory. That's the second stage. So third stage is proliferation or reconstructive phase. That means you already maybe understood what is that, because it's reconstructive. So it's naturally going to be healed. Then the granulated tissue will start. So that means the third stage that will happen in 3 to 24 days. Okay, so fourth stage, so just remember this stage. Then fourth stage means maturation or remodeling phase. That means re-epithelialization, reorganization. That will happen 21 days onwards. So sometimes it will take a year to a wound to heal. Okay, so just make sure that your patient is changed whenever you can. Actually, it's every second hourly you're supposed to turn, but nowadays there's short staff, and if you can't do it, just try to do how much, at least just change the position if you can. Okay, in 2 hours time, or just ask somebody to do it for you. Okay, otherwise if there is a pressure damage occur, means it will be very difficult to heal it, and you will be responsible for that. So just make sure that your patient won't have any pressure damage because of you. Okay, so I hope you understand the phases of wound healing. This is a question usually come across in CBT. So just make sure that you, because it's nurses' responsibility, and some of the nurses don't take as their responsibility, like look after the skin. Look after the skin means you may need to clean their bowels and urine. You have to make them, if they are incontinent, you have to clean them. Some nurses are not thinking that that's their responsibility. It is support workers' responsibility. No, it is your responsibility. If something happened, you will lose your pin. Okay, so make sure you are doing your job properly. Okay, so anyway, that's a phase of wound healing. I hope you all wrote it, or you all studied by this time now. Okay, go to the next stage. So the next one, what I'm going to explain, in the beginning I have said that the area of damage happened in the tissue. Like, you categorize the pressure area or a pressure wound or pressure ulcer, like according to the stages, or according to the damage happened to the skin, like grade 1, grade 2, grade 3, grade 4. Now, before it was called like grade 1, grade 2, grade 3, but now they in our hospital is changed to category 1, category 2, category 3, category 4, like that. Okay, then if there is no damage, how you check the skin, I have mentioned that earlier, but I'm just saying, if you have a bony area, like, let me show you here, my elbow, if you press for like that, then you just leave it, and it's you can't see anything in my hand anyway. So if you press that and then leave the skin, then it will naturally comes back as normal, like that called is blanching. Yeah, so some of areas when you press it and leave it, it's not coming back as normal or not coming back as a pink. That means non-blanching. That means there is something inside that area. That means some damage happened to that area. That means it's going to start the pressure damage. Yeah, it is not visible at the moment, but it will be visible later. So that is non-blanching. Okay. So you may hear or see that type of words, blanching or non-blanching skin. Okay. So the pressure areas, what all the areas are, which all the areas mostly affect the pressure source, where there is a bony area when you are lying. So if you are lying, your here you may have the pressure source here, back of here, or your spine, because when you are lying, your spine, you may have the pressure source, your buttocks. Okay, so buttocks, both buttocks may have the pressure source, and in between that buttocks is called sacrum. It may have the pressure source. Then in your leg, the back of the heels, the heels, that's a pressure source areas. Oh, one more thing I forgot to say, like if you have patient, some of the patients have pressure sore behind the ear. Sometimes it may due to the, if they are using the oxygens, the nasal cannula, or if they are lying here, they may have the pressure source. So that is a bony prominence can affect the pressure ulcers. Okay, pressure ulcers can happen in these bony areas. I have to rephrase my sentence. Okay, so some of the then what I have to mention about moisture damage. Moisture damage means sometime there will be a wound, but that's may cause because of the incontinence of the patient, urine or feces, or there is some secretions because of that. That's called a moisture damage. That's not that sometime it will heal automatically. Okay, you don't need to do anything. That's called moisture damage. That's not a pressure ulcer. That's not in the bony prominence. That is called moisture damage. Okay, so in the groin you may have the moisture damage. So some of them say uncategorized. Why is uncategorized? Means the pressure source have a shape usually. So if there is no shape, that's irregular shape, and it's not in the bony area. So, or sometime you may see the wound, and you can see a necrotic wound there, but you don't know what is inside. Yeah, so that time you can categorize that wound. You can't say this is category 1, category 2, category 3, category 4. We don't know. That type of wound, sometimes the TB and tissue abdominis document as a uncategorized wound. Okay, so that's a type of the wound. So how do we I have mentioned earlier that some of the wounds can heal it or naturally. Some others need dressings continuously, or every weekly, or every 2 days, every 3 days. The TVN will prescribe or advise us how to do, or when to do the dressing, how to do it, which all the dressing materials we need to use. Okay, so some of the dressing is some of the dressings are using in the hospital in the UK, like Softpore, Mepor, Atruman, Medihoney. There are some, I forgot the name of the, there's like a Maggie, forgot the name, like it's like maggots, okay, like it's like the eggs of the maggots. Then you dress that wound with maggots. Then what maggots do, like the worms. So because the pressure areas, pressure area, that has got lots of dead tissues. So the maggots will eat all that dead tissue, then it will be bigger, the maggots will be bigger. Then what will happen, the pressure area will be clear, and it will have a granulation to have a new tissue. That is a good wound dressing. I really like it because I have seen so many patients wound healed so well because they have the deep wound grade 4. I mean, at that time it was grade 4, and it's really healed very well. So yeah, I really like that type of dressing. Yeah, anyway, and Medihoney dressings are very good as well as ointment. Then if there's a blanching skin or non-blanching skin, if there's no skin damage, you can use a derma as cream. If there is a small skin breakdown, you have to use a lollipop like a film. You can just apply it, so you don't need to apply for 24 hours if there is no continency for 3 continents. Like if the patient is not open bowel for 3 times, you don't need to reapply again. Okay, there is another way of treating the wound, like negative wound therapy. Negative wound therapy means it's a machine here, I think it's called vacuum therapy. Like you cover the wound, then it's a machine connecting to that. There's a long tube, like it's connecting there. Then the machine give the pressures, the negative pressures, then the wound naturally healing. Like you're giving the pressure, then the wound is naturally healing. The size of the wound will reduce, and slowly it will heal. There are some criteria, like which type of wound you can use vacuum dressing. Okay, then that benefits means you don't need to change the dressing so often. What I have to say, I think, yeah, then there won't be any smell because of the vacuum dressing, and the patient can walk with the machine. And then the what I said, the negative pressure therapy, the blood flow will increase, and you don't need, as I said earlier, like you don't need to change so many times the dressing, because the pressure wound you have to change lots of time the dressing when it's weeping. Yeah. Then what I have to say, it's usually known as a topical negative pressure, TNB. Okay, so yeah, so that is about the topic I wanted to explain you, and I hope you may got all my points. This contains lots of questions, so you have to study very well these topics. This is very important. So if you have any doubt regarding this topic, you can comment below in this video. So yeah, I don't want to just come and say all these questions. So what are the phases of wound healing? Then I will say, yeah, hemostasis, epithelialization, all that, like that, there's no point. So if I say like this, you understand what is the topic, and you can answer if whatever way they twisted the question, you can answer. That's why I meant. Okay, so don't forget to subscribe my channel, share, like and comment, and press the notification bell. Bye bye and take care.